The Coordinating Minister of Health and Social Welfare, Professor Mohammed Ali Pate, says that President Bola Tinubu's commitment to maintaining Nigeria's polio-free status is based on the federal government's collaborative enhancement of Nigeria's primary healthcare system with state and local governments. The minister stated this when he addressed world leaders and philanthropists at the Global Polio Pledge event in Abu Dhabi in the United Arab Emirates. He explains that Nigeria's efforts in mass immunization has led to over 50 million children being vaccinated against yellow fever, measles and HPV for young women in just 2 years, adding that the adoption of technological advancements in vaccine deliveries in the country is accelerating Nigeria's ability to safeguard the health of its population.
99.9% reduction from where we were. Tens of billions of dollars invested, hundreds of thousands of dedicated health workers working across multiple countries. We have achieved a feat that has to be completed. I think in these times of uncertainty, when hope is shaken in terms of the state of the world, I would argue that the story of polio eradication gives us an important reason to renew our hope. For us in Nigeria, this is something that we've gone through and we're still at it. I remember when I was a young boy, I had friends who could not go to school. I had young men who could not play soccer because they were afflicted by polio virus. And today, Nigeria had been certified wild polio virus free.
Also addressing the forum, renowned philanthropist Mr. Bill Gates says developing countries are at higher risk of a polio resurgence and require more than what the international community is currently making available to protect the health of the global south.
The name of the game here is that if a country is healthy, then it can educate its kids and have economic growth and become self-sufficient. So many recipients like India, Indonesia, Vietnam, took Gavi money and other primary healthcare work and now are completely self-sufficient. And although we have a long ways to go to get every country to that point, our aspiration over the next 20 years is that we get every country to have healthy kids who thrive, and that they're completely self-sufficient.